Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
Hello, this is Stephen Bittinger, and I thank you for taking some time to listen to this episode of Triage with K&L Gates. I'm a healthcare partner. I practice in Washington, D.C. and Charleston, South Carolina. And within our national healthcare group, I focus on reimbursement defense and compliance, which means I get to fight about the money related to healthcare. And I do a lot of audit defense and struggles between payers and providers. I work on the provider side. So today I really want to talk about an important topic for my practice and for providers all over the country, and a pivotal key issue at this moment in time with the COVID crisis that's going on in our country. So as many of our listeners are probably aware, the regulations and enforcement regarding reimbursement compliance changed dramatically with the public health emergency and the implementation of the 1135 waivers. During this time, Medicare decided to relax some of the enforcement of audits and medical reviews of providers to determine compliance with the regulations for each of those different types of claims. While they did not suspend fraud, waste, and abuse or integrity audits, they did suspend a lot of the error-based or supplemental medical review audits. However, we received notice just last week that Medicare will be restarting all of their error-based audits again on August 3rd. So for providers out there, what does this mean? It means that predominantly Medicare fee-for-service medical reviews will be restarting. The targeted probe and education program will be restarting. And if you haven't heard of a TPE audit, that is focused on one individual provider's compliance compared to their peers according to CMS's data. And so that is across the board. No matter what type of provider you are, TPEs can definitely impact you. Those will restart. TPE audits are performed by your MAC, your Medicare Administrative Contractor within your jurisdiction. Also, RAC audits. The huge struggle of error-based audits that are performed will restart on August 3rd. And during this time, they've been collecting a lot of data. So make no mistake, RACs are contingent fee-based auditors. They don't get paid if money's not coming in the door. So for the past 4 months, they've been collecting a lot of data, sifting through it, and getting ready to restart their activities. Also, there'll be supplemental medical review audits. There's a number of key issues that also came out in the FAQs produced by CMS last week that notified us that they are going to restart the audits. Some of those focus on the continued relaxation in certain areas. For instance, CMS is not going to be requiring signature for a proof of delivery for Part B drugs or certain DME services. CMS is not expected to enforce medical professional signatures in non-emergent ambulance services. However, there are key issues that are restarting. So repetitive scheduled non-emergent ambulance transportation, or for prior authorization model, CMS is expected to cease enforcement discretion on August 3rd also. Claims submitted under the Review Choice Demonstration, RCD, for home health services. Those will restart. So all of your home health agencies out there, I know that you're struggling a lot with the containment of COVID and how to handle yourself compliantly and carefully during this crisis. The unfortunate news is that the Medicare review will restart. Also, for DME providers, it is important to note that although there's some discretion, on August 3rd, the prior authorization program will restart. So that will require a signature prior to submitting a claim for payment. DME may be ordered verbally. However, any type of power mobility devices, a PMD, will require a signature for delivery. Orders signed by electronic signature will be acceptable, though. And the FAQ also specifies the dates of service for which prior authorization will resume for limb prosthetics. So if you are a prosthetic provider, make sure that you carefully read that FAQ. Now, this notice is not such a dramatic event, except that we knew it was coming. We just didn't know when. When would the audit machine be turned back on? And now we've got a firm date, and the big questions remain: how is it going to be changed related to COVID? So during this time, we know that a lot of regulatory regime for reimbursement shifted. Telehealth had dramatic changes during this time period, and many providers, both hospital-based, had implementation for how services are delivered virtually. Physicians' practices, within the long-term care arena, we had dramatic changes for telehealth. Some of those will continue, but the major problem is, were they implemented correctly? So it's really important, despite the multiple layers and instances of how the regulations changed for delivery of a service like telehealth, the claims will be evaluated according to the standard that existed on the date of service. So providers, you got to go back and you're going to have to look at each regulatory shift for the individual time period that a specific set of regulations existed. Also, we're going to be looking at, hospital providers. You had a elevated reimbursement for treatment of COVID patients. And we know that auditors are going to be evaluating, when did the patient test positive? Did they test positive, at the time that they presented? Or was it a positive during a hospitalization stay? What is the priority of comorbidities? All those are going to be questions as the auditor reviews, was the provider entitled to that elevated reimbursement? Same with ventilators. Ventilators are a key question. Was it an appropriate use? Was it not an appropriate use? What was the reimbursement difference there? So this notice today is predominantly just focused on being aware that reviews are going to be restarting and that providers should be taking the time to self-audit right now. Providers should, in advance of the auditors coming, be looking at, did we meet all the requirements for our services during a specific time period? And if we made an error, we need to quantify that and return it. Right? One of the greatest preventions of audits is self-auditing and returning overpayments. Because as you know, an auditor's got the ability to extrapolate. And we've had such an enormous volume of reimbursement go out the door during this public health emergency that an extrapolation on a key issue of treating COVID could have dramatic financial consequences. So compliance professionals, healthcare counsel, take time to carefully evaluate. So I hope you've enjoyed this short broadcast, and please always feel free to reach out. Pray that you are healthy and have a good day. Thank you.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.